You are now listening to Nailed It, the Orthopedic Surgery Podcast.
And then just a few other things. So what's the call schedule going to be like? What are your night duties going to be like? How often are you going to take call? Do you get paid to take call? That's another big thing. At our institution, we do not get paid to take call. I know at other places they do, so every call you take, you get paid $2,000 a weekend or whatever, and people are fighting over it just to do it. Whereas in other places, if you're not compensated, then you can see how that can be an issue. So you just want to be aware of that. For private places, is it going to be, you're going to have any opportunity to be partner or to buy into the practice, to buy into the MRI suite, buy into the surgery centers? For us at like academic health systems, that's not so applicable. Opportunities for leadership. Do you see yourself being a program director, fellowship director, residency director, chairperson? In terms of retirement, what's the benefit structure look like, 401k and retirement plan? And then malpractice tail coverage. So in the off chance that you change practices or you leave the first organization that you get your job in, is the malpractice going to cover you? And then what's the malpractice coverage going to be like when you're actually at your institution? So
yeah, I think those are all, definitely great points as far as contracts and being able to figure out the different parts to what you need to know. And I know when I go back and re-listen and edit this, I'm going to take some more notes, some more notes down on these different things, because I'll probably be going into that pretty soon. And there's a lot of residents I'll be going to that as well.
Sure.
And I wanted to, again, great points, Dr. Atanda. And I kind of wanted to switch gears a little bit.
Okay.
And because I know that you give many talks on, physician wellness and physician burnout as well.
Mm-hmm.
And this is something that, at least in my experience in the past, wasn't talked about as much. And just like you were just making a couple of the points on kind of the thought or kind of, I guess, a culture with, medicine, that you're supposed to do a lot of these things on your own time. And for a long time, physician burnout wasn't talked about. But in your experience, what have you seen, I guess, what does physician burnout look like? How do we recognize it? I feel like there are certain times where I may be getting burned out as well doing this podcast and being in residency. So what are some of the things that, we should note about physician burnout per se?
Yeah. Burnout is a buzzword that's common in medical and lay literature now. When I was coming up, I almost never heard this term in medical school and residency. And if I did, it was really to refer to somebody who wasn't tough enough and just couldn't handle it. And we now know that it's an enormous epidemic. And it's something that was well established way before COVID. But COVID obviously exacerbated it and made it a lot worse. When we look at kind of, orthopedists and whether or not they're burnt out or depressed, we have data from recent surveys that have shown, up to 40% of orthopedic surgeons are either burnt out, depressed, or both. And that it's had a pretty significant impact on their lives. And as I mentioned, it started well before the pandemic. And when we look at, what contributes to it, and we have a few slides to show, a lot of it at the top is bureaucratic tasks that you can see. Some of the things that we do to cope with burnout is exercising, but also people are doing not so productive things like eating junk food, sleeping, using drugs, drinking excessive amounts of alcohol. But scary enough is that most people aren't planning or have not ever sought professional mental health care, almost 70% of the time. And we know that, up to 50% of orthopedic surgeons in general, trainees and, faculty members do display burnout. Here are the signs and symptoms. When you look at these things, emotional withdrawal, cynicism, irritable behavior, workplace conflict, this sounds like residency,
Oh, I was gonna say,
know
me.
You talk about burnout. This sounds like just going to work. Irritable behavior and workplace conflict. You can take that bold it, italicize it, frame it, hang it up on the wall of every operating room in this. Irritable behavior. How many times have you come across a surgeon that seems irritated or, listen, Don't even get me started. When I think about the days when I was in your shoes, maybe younger, like an intern or two, and I was going to take call like on a Saturday, I would be, in the call room, just getting prepared. It's like you're gearing up for battle, right? You're getting your shield, you're getting your sword, putting on your bulletproof vest on, getting your straps on and everything, because you are going to battle, whether it be the emergency room, the internal medicine docs, the peds docs from outside hospitals giving you a call. And it's just, you were just trying to survive. You know what I mean? And you were they're like landmines everywhere. And, I'm a very kind of calm, quiet guy. But even me, I mean, conflict is a big word, but you always at least get into some sort of disagreement or whose service a patient should be on. But my point is, that's like the knee jerk. When you get a phone call and you look at, back in my day it was a pager, and you look at the number, you see it's from the emergency room right then and there, like your endorphins start racing, you start sweating a little bit, you're already upset.
It's still a pager.
Okay.
It's still a pager. Same endorphins.
But so as a resident, I don't have to tell you, the conflict is just ingrained in your brain and in the culture that we work in. So when I was reading through this stuff, I was like, I was expecting to see like some really significant symptoms and, depersonalization, diminished interest in providing safe and optimal care. So even as an attending, I'm going to clinic tomorrow. Let's say I show up, there's 20 patients on my schedule. And then throughout the day, 2 or 3 of them fall off for whatever reason. They're just not coming. I'm not like, oh my God, what's wrong with these patients? I got to give them a call. I got to check in on them. I'm like, oh, thank God. That's 3 less patients that I have to see, like you start thinking of patient care as work, right? It's not all glitzy and glamorous the way it was when you were like a 2nd or 3rd year medical student. It's just more work to do. Just like when you're a resident, the ER calls you for a consult. And then by the time you get down there, like, oh no, the patient left AMA, or we don't need a consult anymore. You're like, okay, you check it off your box and you keep moving, and that's what people also consider depersonalization, right? Because these are people, but you kind of take the personal aspect out of it and translate it into work. So long story short is we are all on this spectrum at some point, and you get more or less on this spectrum depending on the year of training you are and depending on what's going on. But I was shocked when I started this work, because I know for a fact I have been along the burnout spectrum. So,
oh yeah, me too, for sure.
When we talk about the drivers of burnout, you can see all the things here: decreased meaning in work, excessive workload, inefficient processes. But I kind of get into it a little bit more practically. So I talk about burnout as filling up your gas tank, right? So every morning you wake up, you have a full tank of gas and you are just ready to go. You're fresh. You have your coffee. If you drink coffee, I don't. But anyway, if you take a shower and you're ready to go. But then there's professional things that wear us down. And then there's personal things that wear us down. And when we start professionally, so decreased meaning in work, sometimes you're doing work that doesn't mean all that much to you, and you're just on a rotation and you're just trying to get through it. Or you're seeing patients that have problems that you don't necessarily resonate with. Obviously, excessive workload, excessive work hours is huge, specifically for trainees. Oh my God, don't even start on inefficient processes. Anybody who works in an academic center knows that there are just processes out there that are just meant to screw you, right? Like you just have to do all of these, what we call workarounds, all of these extra things just to get a job done. I mean, how many times have you been on call on the weekend and you have a patient in the ER that needs surgery and you yourself push them to the operating room because that that's the fastest way to get them there? I don't know if people still do that. I did that a bunch.
Oh yeah. No, we've done the same thing. Went and got the patient just to get everything moving.
Right. And you would think that the system would have processes in place so that your patients can get from point A to point B without you having to intervene. But sometimes it's inefficient and it's the weekend or it's late at night, and it all falls on you as the physician, which is unfortunate. Lack of autonomy and flexibility. This is key. Even as an attending. I mean, you think as a resident, you don't have control over what you do. Try having what you do directly correlate to someone else making money. So my presence at the hospital is key. If my 8-year-old comes up to me today and says, "Hey, Daddy, next Thursday, we're going to the Philadelphia Zoo. I was wondering if you could be a chaperone. That's impossible, right? There's no way I could do that. A, there's a whole bunch of patients that are already scheduled. B, I need administrative approval 6 weeks in advance to be able to cancel a clinic. And that's a little bit shocking since I'm the surgeon and I'm doing the work that brings the patients to my clinic. They're coming to see me, and I'm, not to sound arrogant, but in general, we tend to be one of the more educated, professional, experienced, talented folks that work in the hospital, yet we have the least amount of control over what we do every day. And you want to talk about a driver of burnout, when you start to realize that, that's pretty demoralizing, when you have to ask somebody who's half your age in order to get, administrative leave. Regulatory issues, so HIPAA and compliance and legal and all that other stuff that, all those extrinsic things that dictate the work that we do. If there's a misalignment with culture and values, moral distress, if, obviously if you've had an untoward event, a complication of death, these are things that weigh on you that you need to carry around. Emails and meetings, oh my God, don't even get me started on this. I mean, how many emails we get a day about various things, and they're not emails like, oh, hey, Dr. Atanda, happy Monday. Just wanted to make sure.
Oh no, never that.
Okay.
Not even as a resident.
No, it's why didn't you close this chart? This mom is upset. You need to read this MRI. This ER attending's mad because you were rude to them. I mean, those are the kind of emails that you get, and they pile on, and you have to read them. Sometimes they're infuriating. Sometimes you have to respond. Sometimes you now have to log into something because of it, and it takes up a lot of time. Other people. I don't know if you're a Seinfeld fan, but I think Jerry Seinfeld said it the best. He said, I can't stand people. They're the worst. Because if you think of every issue, every pressing matter, everything that's really ticked you off that's ever happened to you in your medical career, I guarantee you every single one of them has involved another human being in some which way, shape, or form, whether it be a co-resident, a med student, somebody you report to, a patient, staff member, anybody. And just navigating your interpersonal relationships on a day-to-day basis with people can be completely draining. Because I always talk about how we are not trained to communicate and interrelate with other people. We don't get formal training in that. We just kind of just learn it trial by fire. And you can imagine, when you're dealing with those other doctors and those consults and the ER and all that stuff, how much emotion bubbles up into that. And if you don't know any better, which a lot of us don't, you can get kind of taken over by that, and it wears you out over time. And as you know, residency training is long, but your career is even longer, and it's day in and day out. And last but not least, a couple other things. So obviously closing charts, computer-based training, the electronic health record can be an issue. And then I always put on here yourself. If you're anything like me, if you're type A, neurotic, perfectionist, I mean, you drive yourself mentally into the ground, comparing yourself to other docs, other residents, other people. Am I fast enough? Am I smart enough? Did I score high enough on my OIDs? Are my numbers good enough? We constantly push and compare ourselves to other people, which can bring us down, because that's how we got to where we are, by kind of pushing ourselves. But it gets to a point where it can be counterproductive. So in terms of the professional side of things, that's kind of my list there. And then briefly, I go through all the personal things that are drivers of burnout. So if you have kids, obviously, kids, they don't care that you work many hours and you're tired and you're frustrated. When I come home, my kids are like, oh, daddy, I need $2. Oh, my password doesn't work. Oh, my belly hurts. I'm hungry. He kicked me. That's all you get. Nobody is there supporting you after a long day. And, you may be married, have a spouse, significant other who needs your time and your affection and your energy. If you have family members around or have pets, you just saw me earlier dealing with my 2 cats.
Yeah, cats. Yeah.
They don't care that I'm trying to shoot a podcast.
Right.
They want to be pet. They need to be fed. Friends, I have a lot of friends, and most of them are not in healthcare. The guys I grew up with are still close to me this day. We all went to elementary and middle and high school together, but sometimes they just want to do random things during the week, and they don't understand that, hey, I got to do surgery. I got to do this. And, then you got to deal with them and check chores and errands. Groceries don't buy themselves. The litter box doesn't clean itself. Somebody has to do all of those things, regardless of what kind of day you had in the hospital. And then last but not least, again, I always put yourself on there. If anything like me, I'm a divorced dad now, and I worry, am I a good enough dad? Do I spend enough time with my kids? Am I a good enough role model for them? What kind of brother am I? What kind of son am I? Am I making myself available for my own family? Like, these kind of thoughts weigh you down. And, this is just kind of an informal list, but these are the kind of things that I always talk to people about, to just be cognizant and aware of. Go ahead.
Yeah, no, I was gonna say I can relate to many of these, and I have friends as well as other friends that are residents, orthopedic surgery residents that deal with a lot of these things, especially kids, spouse, significant other, feelings of self-doubt and saying, oh man, like I should be able to do this by now, and you kind of just start to mentally burn yourself out. And I definitely think it's important to be able to recognize a lot of these things. And one thing I wanted to ask you is, what are some things that you can do to try to alleviate burnout or recognize it? Or what are some of the things that, like tangible things that us as residents, or, there's some attendings that listen to this as well, and medical students, what are some things we can do to try to combat this burnout?
Yeah. I wanted to just talk a little bit about what the burnout does. Some of the ramifications of it. So you can see here, there are both personal and professional ramifications. On the personal side, there's broken relationships, alcohol and substance abuse, depression, anxiety. Suicide is obviously a very major thing. It came to light with Dr. Lorna Breen, the ER doc in New York during the pandemic. In our hospital, we've had 3 physicians commit suicide in the last 2 years, unfortunately, which can have a huge toll mentally, but also professionally in terms of patient care and finances. There's obviously a higher risk of medical errors, decreased quality of care, poor patient satisfaction, decreased productivity and professional effort, and high physician turnover. I mean, if people are quitting because they're burnt out, I mean, that's a big problem. And, one of the things that I talk about with burnout is, I don't think the problem is the people who are burnt out and quit and leave. The problem is the rest of us, right? Because we're all on this spectrum, and we all come to work every day. And if you're burnt out, but you're quote unquote able to be tough enough to come to work and tolerate it, sometimes that's almost worse, because those people who I'm talking about, who they're just not pleasant to be around. They're irritated, they're not nice, they're not friendly, they're cynical. And they come to work every day. And as long as they're seeing patients and doing procedures, and, they're not stealing money or doing anything illegal, like, nobody says anything. But in actuality, burnout is contagious. It's like a virus, and what happens when you're in an OR and the attending comes in and is just like yelling at everybody? What does that do to everybody else in the room? It tends to make them cynical and jaded, and want to yell at people. So the problem with burnout isn't so much the people who quote unquote can't handle it. It's actually everybody else who can handle it, because if they're not handling it appropriately, most of how we deal with burnout is with anger and frustration and negative things that we permeate throughout our environment. So that's always something to consider, because, when I was coming up, the culture was, well, such and such couldn't handle it and they quit, or they changed jobs, or they left residency. But that's probably almost a good thing, because now they're removed from the system and the environment, and they can go and get help in different things. It's all of us who kind of just drag to work every day and tough it out that can be the bigger issue from a large academic health system, because you can't really quantify necessarily, how people being burned out can affect their environment, but it's definitely there. A little word about suicide. As you see, there's several hundred of physicians that commit suicide each year, which is quite staggering. That's probably like a med school class and a half every year on average that disappears. And so that's very unfortunate. We see our anesthesia colleagues tend to be at high risk, mostly because of the nature of what they do, but also because of the medications and such that they have.
That would make sense. Because I was wondering why, typically, and maybe I may just be thinking about this wrong. But when you think of anesthesia, you think of, kind of relaxed lifestyle, like leave at 1 o'clock. But, it is true. Definitely, they have access to different types of medications, and maybe just kind of the work they're doing, maybe a little bit more of a stressful job, depending on, I guess, the complexity of the patient. But that surprised me when I saw that.
Yeah. There's definitely a lot of access issues to narcotics and sedatives and different things. I don't think, I think it's probably more stressful, more numbers of suicides in surgical subspecialties. But I think the anesthesia folks are at highest risk, just because of, some things related to their field. So organizational systemic level interventions, we know, are the most bang for your buck when you're talking about trying to mitigate the effects of burnout. I think part of the culture in healthcare has been unfortunate in the sense that we create an environment that's very toxic and very chaotic and very fragmented. And then we leave it up to the individual to ensure that they can tough it out and they can survive it. So a lot of the interventions for burnout historically have been things like yoga and stress reduction and mindfulness and, that sort of thing, which puts the onus on the individual, which is fine. Those things are helpful, but it's kind of the canary in the coal mine analogy, right? You can't just make the canary stronger. You have to make sure the coal mine isn't eluting methane gas and it's not a toxic environment. So you have to do a little bit of both. So there are coalitions out there which are great now to improve well-being, and really address physician well-being. This is something that we did in 2021 in San Diego last September at the previous academy. We had a panel to address burnout, and I was the moderator for that. And we had some kind of distinguished speakers nationally to talk about their experience and the different aspects of addressing physician burnout. These are kind of the big things in terms of priorities to address physician burnout. So, improving workload efficiencies and providing appropriate support. So that's, making sure things run smoothly, decreasing the amount of work physicians have to do, but also making sure physicians are doing the right work. So you can imagine as a resident, you're doing all sorts of things, most of which, specifically when you're on call, shouldn't be your responsibility. There's a lot of non-clinical administrative things that you do. You're ordering things, you're making calls, you're calling outside doctors back and parents back and patients back, which are not necessary of an orthopedic surgeon. So we have to make sure that the workload is not just enough, but it's appropriate. Work culture and environment, so ensuring people have appropriate leadership and communication skills, that we have a workplace that's collegial and that we're kind of growing and nurturing our trainees as opposed to using them as mules and then just strapping them with more work to do. Work-life integration, flexibility, and autonomy. We touched on this. We have to ensure that people aren't just surgeons, but they're human beings who happen to be surgeons, right? And we have to ensure that we integrate their work into their regular lives and give them the control to do so. And meaning in work, this is a big thing. So obviously 100% of the time, you can't just do what you want to do. But if you can do something at least one day a week as part of your job, which can align with things that bring you meaning, that has definitely been shown to decrease the risk of burnout. So for me personally, I do a lot of telemedicine and a lot of telehealth. I work with our telehealth folks. And I also do this role as Director of Clinician Well-Being because it means something to me. It brings me joy, but it also is in alignment with what the hospital needs, wants, and benefits from. So them allowing me to do this part of the time has been very, very helpful for me because, I still go to work, I still see patients, I still do surgery, but I also have about a day and a half a week where I can do some very meaningful work. And if everybody had that opportunity to do something that was particularly meaningful for them, I think that would be key. Yeah, so individually, there's a lot of things that one can do. And again, I tend to shy away from things that focus on like stress reduction and mindfulness and yoga and anxiety reduction, because I feel like that's almost like putting the blame on the individual. That's just my personal belief. I feel like doing those things suggests that, okay, well, you're not strong enough, quote unquote, or you're not, able to handle the rigors of healthcare. But I feel like giving people tools that are more practical and giving people tools to be able to deal with their environment is much more effective, and it also makes them feel better because it makes them seem like you're working with them. So managing your time is key. The Eisenhower decision matrix is huge. So this is something that a lot of residents can use just to manage their time. You think about all the things you have to do and how important they are versus how urgent they are. So obviously the things that are really important and really urgent, your patient crises, deadlines, pressing problems, those are the things you're just going to have to do, right? You just have to find some time to do it. Things that aren't so urgent, but are still important, are going to be more your personal stuff, exercising, family time, recreation. So these are going to be the things that you schedule time to do, right? So it's not going to be necessarily pressing, but you should find some time to do these sorts of things. Things that aren't urgent and things that aren't important, you definitely want to try to just get rid of them. So that's going to be your social media, office work, watching TV. Obviously, often, watching TV can be relaxing and can be a good thing, but I would probably just do half hour a day or something like that just to unwind. You don't want to be binging your favorite Netflix show 4 or 5 hours a day. Got a lot of other stuff to do. And, social media, I mean, just think of how many times you get on Instagram or TikTok or something. Next thing you know, you look up 45 minutes has elapsed because you're just going down the rabbit hole, and you're looking at, what person just brought this new car? Oh, okay, they just got engaged. Oh, look at this baby shower. And next thing you know, 2 hours has gone by. And, not to say it's wrong to keep up with your friends and just kind of stay relevant personally, but you just have to put a nice little check rein on it because screen time can be huge. And then this is something that, I've had to learn the hard way. So for things that are urgent but not so important, specifically emails. And we talked about this before, phone calls, meetings, interruptions. Unfortunately, as a trainee, there's just going to be lots of things that you just have to do, that you just get dumped on to do. But as you get more and more senior, you get newer in your career, when you start your practice, if you can find somebody, and I wouldn't say find someone to dump things on, but I would find people to delegate things to. When I first started, I was very kind of in the mindset, okay, well, if I don't do it or I don't handle it, then it's not going to get done appropriately. I was just kind of a control freak. But sometimes you just got to let go of that control because it's just weighing you down. So now if I get an email, sometimes I'll forward it on to my secretary, I'll forward it on to my athletic trainer or my physician assistant, and just let them handle it, and, that's their scope of work. They're there to assist me and do a lot of those things for the patients. And I try to focus on the phone calls and the meetings and the emails that only require like an attending orthopedic surgeon, and everything else. I just try to let other people handle it because there's not enough time in the day just to do everything. Things about delegating in life as a resident can be tough because you don't have a lot of money, but childcare, meal prep, doing chores, errands, yard work, all of these things. Again, as a resident, you may not have the funds, but if you can scrape things together, it's a very good investment to think about. Even just having somebody come clean your apartment or your house once a month or once every 2 months, it's something because
it helps.
Yeah, I mean, it totally helps.
Yeah.
Unless cleaning a dirty bathroom honestly brings you joy and happiness. If it does, more power to you, then you can clean your house. But, these are the things that we just have to do, right? I mean, I love eating, but I don't like cooking and I don't like cleaning up after I'm done eating, So finding people that you can delegate anything to, even if it's one tiny little chore, I think it can be helpful.
Yeah, I remember either hearing something or reading something, something along the lines of, I guess, how much you think an hour of your time is worth,
Right.
is worth, is it worth, $30 that you could spend and have somebody do, whatever else it is that they need, that you may need them to do, and spend that hour doing something else more meaningful toward you, or, kind of how, just kind of weighing like, okay, well, how much of an hour is my time really worth? How much time would I be spending cooking 4 meals? Would I spend 5 hours a week versus $40 or $50 to do this meal prep? And now I have another 5 hours to do whatever else I need to do. The more, I guess, more important are the things that you said that you need to do,
Yeah. And, Cody, it's all about opportunity costs. We tend to, if you're anything like me, you tend to be like, oh man, I'm not spending money on that, but when you really look at it, what that $50 or that $100, like, what do you get in return? It's not just, oh, well, somebody's going to clean my house or prep my meals. It could be, well, now I have 2 hours of my life to exercise, or now I have, an hour and a half to play with my kids, or talk to my family members, or take a nap, or read, or, and and time is precious. As you know, you don't get more of it. You have less and less time on this planet every day that goes by. So finding ways that you can focus on the things that truly bring you happiness and joy, and letting other people help you with other things, can be very, very key. Moving gears to money, we all talk about it, think about it. It's a big thing that pushes us along. But there's lots of things that you want to spend your money on, and things like long-term planning, college fund, different types of insurances, paying back student loans, good investments, an affordable home and an affordable car. As a sports guy, I had attendings when I was a fellow that had nice cars and nice clothes and nice homes, and that's all I wanted.
Yeah.
But now I know that, the more money you make, the more problems you have. And if you have expensive things, they are expensive to take care of. So you want to watch out for going out and buying an $80,000 car and a 10,000 square foot home and a $3,000 suit, and all the fancy jewelry and the big risky investments that we tend to do, because again, that can just cause you more problems. And when you think about income and how we make money, this is something I was never taught. So active versus passive income.
I love this.
Yeah, this is a great little schematic. Active income is basically when you trade your time and your energy for money. And passive income is when you make money off of things that come in passively. So you don't necessarily have to be there to collect rent from somebody, or a subscription service you have, or stocks or shares in a company that you get. And, most of us work actively. We get up, we go to work, we make money, and we come home. The problem with that is the potential is very linear, meaning it's directly proportional to your time and your energy. And unfortunately, like we talked about before, that income will stop if you can't work. You always wind up chasing income, and that's the relationship you have. You'll be financially shackled to your job. And the biggest thing is that you won't have enough time in the day to enjoy the money that you're making. So if you have all this nice stuff, you have to trade your time and your energy more to be able to afford those things. And like I said, time doesn't grow on trees. So it comes to a point where all you're doing is working, and you may not even be enjoying all the nice stuff that you have to pay for. And understanding how passive income can help, and again, those are the big things we talk about. Understanding how passive income can help is that you can now find ways to work, but also having extra income coming, buffering what you're doing, so that you don't have to work so actively. So if you have one stream of active income and that's all you have, then that's all you're going to be doing is working. But if you have several other passive income streams, that can be very helpful, because now you can have exponential growth. You can create wealth. You can be financially independent to an extent. Let's just say your primary hustle isn't going the way you would like it, and you want to, let's say right now, I want to cut down to 3 days a week. My chair will be like, okay, well, that's fine. We're only going to pay you 3 days a week salary.
Right.
But if I have other things on the side where I'm making, my YouTube channel blows up and people are listening to my podcast and things, and I have extra revenue coming in, then I have the ability to cut back on my active job, and I won't be penalized for it, because I'll still have that income. And the time that you'll get will now be yours, because you can really enjoy what you're doing, because you always have that income coming in. And the way we think about happiness and money, as you can see here, is, obviously there's some level of money that you need to make to be happy, but it gets to a point where it kind of levels out. Meaning, if you make 100, 200 grand a year, and all of a sudden I double your salary, that doesn't necessarily mean you're going to be twice as happy. It just means you're going to make more money. So you have to understand, if you're on that active income stream and you're constantly trying to make more and more and more money, not only is it going to affect how the ability you are to actually enjoy that money, and whether you're shackled to your job or not, it may not actually improve your happiness whatsoever, even though you're spending more time. Same thing with how much money you spend and being fulfilled. There's a certain amount of money you have to spend just to survive and be comfortable, maybe even live luxuriously, but eventually it gets to be enough. And if you just keep spending more money and buying nice things, you're not going to get any more fulfilled. And it can decrease your fulfillment, because like I said, the more expensive things that you own, the more expensive it is to maintain all of those things, and it creates more stress for you. This is a very interesting schematic. Frederick Herzberg was a psychologist back in the 50s, and he studied kind of blue collar steel workers in Pittsburgh area, looking at the kind of things that made them happy. And he kind of broke them down into two groups. I label them as inspirational factors and motivational factors. So your inspirational factors are going to be things that are intrinsic to the work itself. So how you're going to be achieved. How are you going to achieve status at work? How you're going to be recognized at work, the actual work you're doing, the advancement potentials and growth opportunities. And these are inspirational factors. And if you improve these factors, these are the things that are directly correlative to increase job satisfaction, whereas motivational factors tend to be external to the work. So company policies, what hours you're going to work, who you're going to work with, who's going to supervise you, how much money you're going to make, where your office is going to be. And we know that if you have poor motivational factors, that'll decrease your job satisfaction as well. But the corollary isn't true. So if I improve your motivational factors, it doesn't necessarily make you more satisfied. It just makes you less dissatisfied with your job. And that's very interesting, because if I come up to you and say, hey, I have a new job for you, the first thing you're going to ask me is like, how much money am I going to make? And where's my office going to be? And how many hours am I going to work? And that's what we tend to focus on. I don't know if you're getting those locum tenens emails just yet about all these opportunities.
Oh, I'm getting some now.
Right.
Now that I've matched.
In the subject of the email, it's always what? How much money? $650,000 plus with great schools and blah, blah, blah. Nowhere in that email does it say how you're going to be recognized for the work you do and how responsible you're going to be for stuff and what are the opportunities for personal advancement and professional growth. And we know those are the things that are most important to work. If I come up to you and say, Cody, I know you hate your job right now. It's terrible, but I'm going to give you $200,000 a year instead of like $60,000 a year. And I'm going to make sure you have a great office with a big window and you only work 3 days a week. Well, guess what? You're probably still going to hate your job. You're now just going to be less likely to quit, and you're going to be more likely to show up so you can collect that paycheck and enjoy that nice office. But if I don't actually focus on the work itself and your ability to grow and advance in that job, you're not going to be any happier. And unfortunately, the knee-jerk reaction when people aren't happy at work is to give them more money. The problem with that is it doesn't affect the actual work that they're doing and why they don't like their job. And B, those types of motivational things tend to be temporary, meaning I'm going to have to keep giving you a bonus and keep giving you an increase in salary. Whereas if I find a way to really connect your job to you in a meaningful way, the likelihood that I'm going to have to keep doing that over and over is pretty low. Obviously, I may have to at some point. So thinking about what truly inspires you versus what motivates you is very key, because we tend to be poked and prodded by things that are actually external to the work that we're doing. And this is a very good slide, and I enjoyed reading about it. Lastly, we'll just go through a couple of things. We talked about passive income. Thinking about alternative income streams can be very helpful, whether creating a service or a passion project, selling something. These are all things residents and trainees can think about doing, investing in real estate, even if it's something where you get $10 a month. It's something, right? You don't have to hit a home run and invest in a future startup that's going to become Amazon to make it worth your while. I mean, just think of anything that you can do that you enjoy, that brings you happiness, that you could potentially make money off of. Alternative revenue streams specifically for physicians. So there's so much knowledge and so much information swirling around in all of our heads at any given time. And again, if you're not seeing patients and you're not doing procedures, the likelihood that you can provide value to your organization is pretty low. So now there are all these other things. There's so many companies out there that need provider-to-provider e-consults to be done, or patients to get second opinions. I do motivational speaking now. We talked about social media. You may not want to just be looking up what your high school friends are doing, but if you can use social media to market yourself, to spread knowledge and information to people that need it, make videos, things like that, you could potentially get revenue from that. People are working with insurance companies and doing utilization management, case review, and then consulting. There's so many companies out there that are in the healthcare space who have no frontline healthcare workers as any of their leadership. And they'll tap you to say, hey, let's do a conference call for an hour and just talk to us about our idea or about our project. And they'll pay you for that because they're hungry for that knowledge that you have. And most of us physicians have no idea what to do with all of that if we're outside of our main gig. I talked a little bit about social media. This is something that a lot of youngsters who are training can get involved in. This is things that I do. I send information and knowledge to my patients. So we talk about surgery. We talk about how to put on a brace. I talk about youth sports topics. I do things for medical students and pre-med folks who are interested in learning about orthopedics. These are all ways, again, to move knowledge, move information to the people that it needs to get to in a way that can be, profitable or even not so. Like the top 2 videos, I mean, these are just things I send them my patients. I don't make any money off of these, but
Right.
I send them a brief video on how to use their brace so they don't call my office, every day asking me how
save
to
time.
adjust a brace. So
You're saving time. Yeah.
rather than me, my PA or my athletic trainer have to explain this to hundreds and hundreds of patients, I took, an hour, I made one video, and now I send it to every patient who gets a knee brace. Same thing for what to expect in the day of ACL surgery. That's basically everything that I say when I consent people. And, in pre-op, trying to consent somebody who's hungry, who's tired, who's anxious, they're going to sign anything. You can put anything in front of them. They'll sign it. They're not even absorbing anything you're telling them.
Oh, yeah.
But now I send it to them the night before when it's calm, it's quiet. They just had dinner. They can pause it, share it with people. And then they show up to pre-op and they've been primed and they understand what I'm going to say. So I don't even have to go through the whole spiel. I just mark their limb, do a couple necessary things, and I'm out of there. And it saves a lot of time for me. It saves time for the nurses and anesthesia who have to wait for me to get consent. It has a lot of potential benefits. So these are just some outside of the box things that I do, not necessarily purely for revenue, but also to help streamline the care that I deliver. And these are just a couple of other things. This How to Shadow a Doctor. That's my most watched video on my YouTube channel.
Really?
Yeah, it's gotten about 11,000 views, which isn't much, but for me, it's
a good amount. It's more than any video I have.
Right. And this is just something I made because I get a lot of med students and college students emailing me, asking me, not only can they shadow me, but like, what should they do? What should they wear? How should they act? And blah, blah, blah. So I just made this video. Now people can digest it and learn about it. And, it made me feel good to be able to provide information in a way that young folks can digest.
Yeah, I think, that is all good information, especially, the being able to make alternative streams of income, and especially with the passive income. I kind of dive deeply into that. And I like to research things on that and figure out what are some different things that you can do so you're not so dependent on, on funds from necessarily a salary, that you can kind of have and live the lifestyle that you want to live, whatever it may be.
Right.
And I think we went over a good amount of information for the burnout, things that we can do, personal things that we can do, systems that we can try to incorporate in our life. Talked about different streams of income. Is there anything else that you want the listeners, Dr. Atanda, I really appreciate you coming on the podcast, but is there anything else that you want the listeners to take away from listening to this podcast? It can be about anything.
Yeah, I know we've dove into a lot of content. Basically, I've worked with a life coach in the past, and his suggestion was really to try to figure out what my calling was, who I am as a person, what really inspires me, why do I do, what I do. And I think a lot of people aren't very forthright with that information. I think we talk about our rationale for doing what we did in a way that we think people want to hear and that we think is acceptable. When you read personal statements of people going into orthopedics or going into medicine, a lot of them tend to be like the same. And, we want to fall in line and not be an outlier. But what I always tell people is all of this well-being stuff starts with you. And it's all about how you view the world and how you view your place in the world. And it all starts with how you view yourself and what makes you happy and what you want for yourself. And I always encourage people to be open and honest. And I always say, there are 3 reasons that people talk about, like why we do the things that we do. One of the main reasons is one of the main reasons is what we tell other people why we do what we do. The second big bucket of things is what we tell ourselves why we do what we do. And then the last thing is the actual reasons why we do what we do and what inspires us. And it wasn't until I worked with my life coach a couple of years ago and really dug deep into myself and who I am and tried to be emotionally intelligent and self-aware for a lot of the reasons I shared with you, Cody, and the listeners, as to kind of why I went into medicine, why I went into orthopedics, why I went into ped sports. You know, we all have a story. And if there's anything you've learned from listening to me ramble on for the past almost 2 hours, I think you should really just dig deep into who you are, as cringe and as awkward as it seems. Because again, all our years of training, it does not teach us or encourage us to be open and vulnerable and honest with ourselves and the people around us. It teaches us to kind of, put up a little bit of a front, to put a particular version of yourself out to the world that you think or hope people want to see or you think they need to see. But basically, I would encourage everybody to put your true self out to the world, because that's the only way that you can really find true happiness. Whether or not, you have a great job, or you get paid $5 million or $500,000, or you have, the best setup and the best clinic and the best OR. Like, if you don't know on a day-to-day basis why you're walking around doing what you're doing, and you're not honest about it with yourself and willing to share that with other people, then you're definitely not going to be happy, no matter what. So hopefully you learned something from me in this podcast. Hopefully what I said maybe inspired or touched a few people to think about what they're doing and why they're doing what they're doing, and just think about your true calling, your purpose, and just focusing on being happy and enjoying the little time you have on this planet. So that's all I wanted to share. And thanks again, Cody. I really appreciate your time and letting me share my story and get the word out there. Much appreciated.
Yeah, no problem. It was a pleasure to have you on, and we appreciate your words of wisdom and many gems that you have dropped throughout this entire podcast. Now, for those listening that may want to follow you on social media or check out your YouTube channel, where can they kind of follow you at, and where can they find your content and your information?
Yeah, so one of my startup companies, which is basically an all-encompassing youth sports website with a lot of content, is called SportsLink MD. That's SportsLink MD. So that's the name of an Instagram page, my YouTube channel, and also our website is sportslinkmd.com. To find more stuff about youth sports, but also professional well-being as it relates to being a physician and as it relates to being an athlete, and just different kinds of content that's very exciting. So thanks again for having me, and hopefully we can have future conversations in the future.
So Dr. Atanda, again, it's been a pleasure having you on. For those that are listening, please go and leave a review and let us know how much you liked this episode. Again, go follow Dr. Atanda, check out his different websites and YouTube channel and different areas that you could follow him. And again, thanks so much for being a guest on the podcast.